Good morning, everyone, and welcome to our joint education class today. I'm happy that you all had a chance to attend. I see a lot of familiar faces here, so it's nice to see you all again. Today you'll receive a lot of information from your care team here at the hospital. Many of the faces that you see today you're going to be seeing throughout your stay when you're here after your surgery. So please feel free to raise your hand, ask any questions. You're not interrupting. We want to be sure that we answer any questions that you may have. Okay, so Outer Banks Hospital, we've been doing joint replacements since 2002. Some of the fun facts of the hospital, not fun facts, but exciting for us as your care team. At the end of December here recently, we did our 1,000th joint replacement. Right before number 1,000, our patient had 999, her fourth replacement done here at the Outer Banks Hospital. So you're in good hands as we move forward. Again, I'm going to go through in a second and introduce everyone in the room as we move forward today. But again, please raise your hands, be interactive, ask questions. We want to be sure that you get all the information that you need. Okay, so if you don't mind, I'm going to start and introduce myself again, go around the room, and if you wouldn't mind taking an opportunity and introducing yourself and maybe telling us what joint that you're having replaced. Again, Roberta Falcone, practice manager for orthopedics.
Ann Smith, nurse practitioner. I work with all three of your surgeons.
I'll start over here.
Colleen Kinkritz, I'm the infection preventionist, and you will hear me today, but you will also see me during your pre-op visit.
Tricia Benefield, patient access services.
Kristen Richardson, patient access services.
Hi, all. I'm Micah Puffer. I'm the assistant nurse manager for MedSurg.
And I'm Lisa McGaugh, I'm the director of inpatient services, which is going to be the unit that you're going to go to for recovery.
And you'll see more and more people walking in as we start our class from all the different departments.
So this is a very busy slide. It's full of a lot of information. We're going to kind of touch on each aspect of this. When we were developing the course, I asked your surgeons, I said, what information do you feel is very important that we bring to this course? These are some of the things they wanted to make sure that we touched on and talked about. The first one is blood clot prevention and medications. You will receive a prescription for medicine called Xarelto. This will be written for you prior to your surgery. The reason is some insurances require prior authorization to approve and pay for the medications. Once the prescription is written, you'll get a phone call from our office telling you that the prescription is been sent, that you're not to start taking this medication until after you're discharged from the hospital. You'll be started on blood thinners in the hospital, and you'll go home and take them. Depending on whether you've had a hip or knee and who your surgeon is as to how long you'll be taking the medication for. It's going to be anywhere from 10 days to 30 days. So the instructions will be on the bottle. It's taken once a day. While you are taking this medicine, you're to stop aspirin products and all anti-inflammatory products such as Aleve, Motrin, Mobic, Naprosyn, Atotolac, all those medications that you may be on before surgery, you'll stop.
Excuse me, what about ibuprofen?
Ibuprofen, yes ma'am. Any of the anti-inflammatory medicines. And on discharge, we will look at your home medication list and you will be educated and instructed on that again. We also want you to stop those medicines 10 days prior to your surgery, and it should be in your surgery packet that you received at the doctor's office. There's an instructions on before surgery. One of those instructions is going to be to discontinue those medications 10 days prior to surgery. If you're already on blood thinners, your primary care or your cardiologist, whoever prescribes those for you, will give you directions on how we want you to manage that preoperatively, and we likely will put you back on that same medication postoperatively. But we look at each case individually, so not everyone's going to fall into you're going to take Xarelto for so many days. It's going to be based individually. Blood clots are a risk of immobilization. They're a risk of having these surgeries. The signs and symptoms of a blood clot would be a painful swollen calf, may be red, may feel hot to touch. If the blood clot traveled to the lung, you may have sudden chest pain and sudden onset of shortness of breath. It's not something we see a lot of because we work very hard to avoid these things, but we do ask our patients if they have any concerns that that may be an issue, that they contact our office. We likely would send them to the hospital to have an ultrasound done. If it's off hours or weekends, then if you're concerned you need to go to the emergency room, they'll do an ultrasound, kind of screen you and take care of that. If you do develop a blood clot postoperatively, it's just a matter of increasing the anticoagulant medication that you're already taking. Any questions about that?
You were talking about, how about turmeric? Is that okay with you taking it?
Turmeric is not, turmeric is an yes, you can take your turmeric. Yes, pre-op.
About lisinopril and HTC.
Yes.
Staying on that
The
too.
only medicines that you're going to stop before surgery are the anti-inflammatory pain medicines. And if you have a question, okay, good. If you have a question about that, then you need to get up with our office and let us know. But it'll be reviewed with you again upon discharge with your discharge nurse.
So no baby aspirin?
No baby aspirin. No. Okay. Antibiotics prior to dental work. Our surgeons currently, all three of them, want you to be given prophylactic antibiotics before any dental work, including dental cleanings. The highest risk of developing an infection in your joint following dental procedures is within the first 2 years. So it's extremely important that we adhere to this. There's a lot of recent changes in research stating, well, only 2% of joints get infected after having a total hip done or a total knee with dental work. Well, that's 2%. We prefer that 0% of our patients get an infection. The guidelines are currently in the process of changing. So for now, we're asking that before any dental procedures, you contact our office. We will phone you in a prescription for a one-time dose of antibiotic you take 1 hour prior to your dental procedure. This will be dependent upon what your allergies are and what your other medications are, but it's either going to be amoxicillin or Keflex or clindamycin. Typically, one of those three medications will be used. So it's a single dose taken one time prior to your procedure for an hour before the procedure. Now, this may change in the future, but currently we're recommending that you do this for life. We're asking that you have no unnecessary dental procedures done for the first 6 months after your surgery. If you have an emergent procedure, by all means, you need to take care of that because we don't want you getting a dental infection. Keeping your teeth in good condition from here on after having a joint replacement is an excellent idea. Keep up with your cleanings, but any abscess, any dental infection needs to be treated immediately. Signs of a joint infection would be, unusual pain. Hey, I had my joint done a year ago. I haven't had pain, and now all of a sudden I'm having pain. It may swell. It may get red and hot. You may have fever. Anything at all, we want to see you. We want to take care of your replacements forever. Questions about that?
Dental work, does that include your 6-month checkup for cleaning?
Yes, sir, because your gums typically will bleed during cleaning. So most dental procedures, there's a little bit of bleeding. The concern with the mouth is it harbors a lot of bacteria. And when you have dental work, occasionally bacteria will get into your bloodstream. Now that happens, and most of us have very good immune systems, and our bodies take care of this. But the joints, the replacements we put in, the body forms like a slime coating over them. And bacteria love to stick there. And bacteria love to grow in warm, dark, wet places. So it's the perfect opportunity for an infection to develop. And, we may tell you in 3 years' time, the research really doesn't show that we need to continue to do this after so long. But currently, all three of our doctors are not convinced. They don't like the 2%. They want 0%. So they're recommending that you do this. If your dentist isn't comfortable prescribing, please call us and we will prescribe that for you. We'll make sure you have that. Okay? Driving. People always ask, when can I drive? When can I drive? When can I drive? It's going to depend. Did you have your right hip or right knee done, or is this your left leg? It's going to be anywhere from a month to 3 months, typically. I ask patients, if a small child runs out in front of your vehicle, are you going to be able to control that vehicle? Are you going to be able to hit the brakes? And that's the question you have to ask yourself. So again, that's going to be independent. I wouldn't anticipate you'd be driving before a month, but I would hope that by 3 months out, most of you would be able to get behind the wheel of a car. We do have temporary handicap sticker paperwork in our office. If people need one for their post-op period, please let us know. We can fill that out. You have to take this paperwork to the DMV. We can't do that portion for you, but we can get you what you need to have that. So anyone needs one, please give our office a call and we'll get that ready for you. Pain management, very important. Surgery is painful. Joint surgeries are more painful, and the knee surgery is even more painful. So total knees recovery is a little bit longer. You'll probably require pain medicines for a little bit longer than most total hip patients will. Pain medicines come with possible side effects, and that's something we just want to make sure you're all aware of. They can cause drowsiness. They can cause some mental confusion, especially in older patients. We have some people that are in their 80s that are getting their joints replaced, and they tend to get a little more confused. Just having surgery, anesthesia, and being in the hospital can add to this. So those are things you need to be aware of. Hey, mom's acting funny. Well, it may be in part the post-op period, recovering from anesthesia, and the pain medicines. So be aware that they can alter you. You may not be as steady on your feet, things like that. They can cause nausea. Some people will get very nauseous. If you find that, let us know. We'll try different medicine. If that continues to cause nausea, we'll prescribe you something to take that, for the nausea so that you're able to take those medications. Constipation. A lot of patients don't like to talk about that, but we get calls every week from our post-op patients. They're really constipated. Number one, you're not moving around like you normally do, so your gut's sluggish. Your gut gets sluggish after surgery. These medicines slow your gut as well. So drinking plenty of fluids, moving, getting up and walking. There's no contraindication to being up and walking with any of your surgeries. We want you up, we want you walking, we want you moving. Proper diet. Get some roughage in your diet, fruits, vegetables, Metamucil if you need to. Take a stool softener if you need to. And if you're really having trouble, laxative. We have a few people that occasionally have to go to the ER and get cleaned out. So we want to avoid that, but be aware that this is a possible problem. And don't hesitate to call us. We can give you some other recommendations if you need that. What else about pain medicines? I guess they are controlled substances. It is illegal to give your medicine to someone else. It is illegal to sell your medicine. Those are all things that we're required to kind of counsel people about when we prescribe these medications. Keep them in a safe place. Don't leave them sitting out on your bathroom sink if you have workers coming to do work in your home. Protect your pain medicines. Don't leave them out in plain sight if you're traveling in a car. There are people out there that will steal your medication, that will break into your vehicle to get your medication. So kind of keep an eye on your medications. They can be habit forming or addictive. Most of our patients don't have that problem because as your pain is less, you will take less. You'll be prescribed, and it again is going to vary, usually either Percocet, which is oxycodone, or Norco, which is hydrocodone. You'll start on 1 to 2 tablets every 4 to 6 hours. Your next prescription we give you is going to be 1 tablet every 6. The following is going to be a lower dose, probably 1 tablet every 6 to 8. So we will gradually decrease the number of medicines that we give you. And as your pain, because it's an as needed, because it says every 4 hours doesn't mean you have to take it. It's every 4 hours as needed for pain. So you need to decrease the amount that you're taking, and we will help you decrease the amount that you're taking, okay? So I don't want people being afraid to take their pain medicines because you don't want to get addicted. You need your pain medicine. And I think that most of us naturally just decrease the amount that we're taking. Take it prior to physical therapy, and there's going to be a whole section on therapy coming up in the course. But if you take your pain medicine an hour or so before therapy, I think you'll do better in therapy. You'll be able to move a little better, you'll be able to participate more actively. But if you need pain medication refills, call our office. We need a 2 to 3 day window to get that for you. This is not a medicine we can call into the pharmacy. Someone's going to have to come to our office and pick that up. Pretty soon, North Carolina is going to require that we only give 1 week of medication at a time. That is coming soon. Currently, we can give you 2 or 3 weeks, but we don't want you running out, so you need to give us a few days leeway before you run out so we can get those medicines for you. You can pick up the prescription or have a family member pick it up and take it to the pharmacy for you. Questions on pain medicines? Okay. And lastly, just call us. We're there Monday through Friday. There's always somebody on call on the weekend. If you have an issue, call the office number. Do we have a call service? They call the ER.
No, it goes to the hospital.
Goes to the hospital, that's what I thought. And then they try to contact your surgeon, that's on call, and one of them will return your call. If you have, things that you feel are very concerning, then please don't hesitate to go to the emergency room. We'd rather see you there, even though I know you don't want to be there, but we don't want you sitting on things over a weekend that need to be addressed. Questions? All right, you guys are an easy group.
I'm Colleen again. I'm the infection preventionist here, and so what I'm going to do is talk to you about some of the things that we are going to do to help prevent an infection from occurring and what you can do to help also, because it's going to be a team effort with that. So any surgery always has risk of infection, no matter how simple or how complex it is, and it's the same way when you have a total joint replacement. So we're going to do a lot of things. Probably one of the most important things is something that you are going to do before surgery. Protect your skin from scrapes, cuts, things like that. You don't need to be going out and doing massive yard work or anything like that. You need to make sure that your skin on the leg that you're having surgery on is intact. In other words, no cuts, abrasions, or anything like that. If you don't usually cut down trees, don't go out and start doing it right now, because you just don't want to. You had that look. You had that look. Just saying. Okay. Ladies, please stop shaving your legs 3 days prior. Men, please do not start shaving your legs. Okay. So we just need to make sure that we keep that, skin intact. The most important thing that you are going to do is to prepare your skin by cleaning it off as good as you possibly can. Each of you should have received a packet of wipes from the doctor's office. Okay, I'm going to tell you specifically what to do. During the pre-op visit, I'm going to go over which side and everything else so you'll get it again. So first of all, the night before surgery, I want you to take a bath or a shower. You need to wash from head to toe, including your hair, with your regular soap and shampoo, okay? Rinse, dry off really well. Once you are completely dry, then I need you to take one of the wipes out of that packet, okay? You are going to start wiping the leg that you are going to have surgery on first, okay? So you're going to start up here in the groin area, and you're going to go all the way down to your toes. Then I'm going to ask you to flip the wipe over, and then you're going to do the same thing with the other leg, okay, all the way down to the toes. This is a product that's going to start killing the natural bacteria that's on all our skin. We all have it. So that's going to start getting rid of it and hopefully prevent it from really coming back for a few days. The thing is, though, this stuff does not like sensitive skin, so never get it near your private area. Never go above your neck with this product, okay? Once you are done with that opposite leg, then I'm going to ask you to finish the rest of your body, stomach, chest, arms, and if somebody's with you that can wipe down your back, that's good. If not, don't worry about it, because we are going from the highest risk area to the least risk area of your skin. It does not get rinsed off. It just stays on. No lotions, no powders on your skin. We just want it to sit there on your skin. That night, clean night clothes, clean bed sheets when you go to bed that night. How many have pets? Love pets. I encourage you to love on your pet. Pet therapy is a wonderful thing. But you need to protect their fur from getting on your treated skin. So if that means that they can't get underneath the covers, or you're going to have to wear something that's going to cover your skin, just be very cautious. When you do pet them, whatever, make sure that you clean your hands afterwards. You don't want to transfer anything from their fur over to your treated skin. Okay? Next morning, no bath or shower.
My poor kitty sleeps right here near my head.
That's okay.
Oh, that's okay.
You're not. This is not being treated, and
It's far.
it's farther enough away. Just try to protect your skin with clothing so that you don't have to worry about it. Good question. Next morning, no bath or shower. You may wash your face. You can shave. Ladies, don't start shaving, but you could if you wanted to. And you can wash your other private area if you would like. That's fine. But I don't want you to rinse off anything you put on the night before. Actually, what you're going to do is put on another layer. You're going to take the second wipe that was in that packet, and you're going to go through the same routine. You're going to start with the leg that you're having surgery on, then the other leg, stomach, chest, arms, back. Okay? You will get a third dose of this same type of product when you are in the operating room before surgery begins. What you are putting on is clear. You really aren't going to know that you're catching every spot on your skin. But I can assure you that what the nurse puts on, they will know, because depending on the surgeon, you are either going to be blue or you're going to be orange. So you're either going to be a pumpkin or you're going to be a Smurf. Okay? So you're going to see that color tinged on your skin after surgery, your toes, your ankles, and everything. It's going to be lightly tinged. That's just to make sure that they have gotten every spot on your leg to make sure that it's been properly treated. Okay? You will have a Foley catheter more than likely inserted into your bladder when you're in the operating room. Again, you will not be probably aware of what's going on. You won't remember it, hopefully, without any problems. It usually stays in overnight, so it's not a big deal. Before surgery begins, you will also be started on an antibiotic, and that will be given intravenously. It starts right before the first cut, and you will continue to get doses only for 24 hours. That is all that's needed to prevent any infection from occurring, okay? Anything more than that is not really doing you any good. We will keep you warm in the operating room. Historically, operating rooms are cold. So we will keep your body temperature up because, again, being too cold could be a risk of infection. So we want to make sure that your body temperature is up and it is appropriate. When you come out of surgery, you're going to have various dressings depending on not only whether you're having a hip or a knee, but also the surgeon that you have. If you are having a hip with Dr. Mann, you are going to have a very minimal dressing right here in the groin area of your hip. Dr. Mann uses glue to close those incisions. So when you go home, more than likely you will have nothing covering it, and it will be shiny, okay? But that's the glue. Make sure that you do not pick at any incision, any glue, or anything else, and that goes for all incisions. Keep your hands away from it, unless your hands are clean and you're cleaning that area. So it's very minimal for that. For Dr. McKenna and Dr. Chase, when you have a hip, you're going to have a dressing on this side, and it's going to look kind of poofy. Incision is closed by staples, and you will have that dressing over top of it. It's a special dressing that kind of looks like a giant Band-Aid. That stays on for about a week. It does not get removed. You don't peek at your incision underneath there or anything. It's waterproof. You can take a shower with it. Just make sure you dry it off when you're done. Eventually, it will start peeling away. And once it reaches that centerpiece, then it's not doing you really much good, so you can take the rest of it off. But it averages about a week to 10 days that it stays on.
So what about with Dr. Mann? Can you take a shower with his too?
Yeah.
You didn't mention that.
Sorry. Yeah, you can. Actually, for any of the surgeries, you can take a shower when you go home. Not a problem.
Great.
But I just wanted to let you know, for these that have the special dressing on, you don't have to worry about, you don't have to take it off. You don't have to worry about changing it. It's designed to stay in place. Okay? Knees. Knees are going to be a little bit different. Okay? First of all, when you come out of surgery, it's going to be extremely bulky. You're going to have like an ACE wrap wrapped around in several layers around it, and it's going to go like this. The other thing that you might have is what's called a drain. It's a special tube that Mike is going to show you here that's going to be in there to collect any of the excess fluid. We want to get that away from that new joint, okay? It's got a collection thing, and they will routinely empty it. The nursing staff will while you stay here. You won't go home with it. It only stays in a day or two. It's easily removed. Underneath that ACE wrap, again, it's the same type of dressing that somebody would have on the hip. It's a very long looking dressing that looks like a giant Band-Aid. Same thing. It's waterproof. Same exact thing. Underneath that, the staples are the same also. Staples usually come out in about 14 days. And usually if you are going home with home physical therapy, arrangements will be made for a home health nurse to come out and remove them. Unless you're Dr. Chase. Dr. Chase asks you to come to the office and he removes them there. If you are going to a rehab center, then the staff there will remove them.
Excuse me, is this gonna be a long cut on your knee?
Well, it's
That's long.
usually. They got to get that one out and put the new one in.
It'll feel good.
Yeah. Yeah.
Now, when he went in, man went in and cleaned up my knee, I had that ACE thing around it, it would have fell down.
That's okay.
So what if this other one falls down?
Remember, you probably will not even go home with that ACE wrap on it. You will just have that
So if it falls
long
down,
bandage.
it's okay.
Yeah. You'll have that bandage, that one bandage over top of it. One of the things that after you go home and things like that, you really need to pay attention to how well you take care of your incisional area. I usually recommend, unless you have to touch it, keep your hands away from it. Keep your pets away from it, things like that. Don't let them rub up against it. You just want to make sure that you do everything in your power not to cause anything to get near your incisional area. Keep your hands clean. Keep anyone that has to touch your incisional area, make sure their hands are clean. And that's the same thing even while you're in the hospital. If you don't think somebody has either washed their hands or used our alcohol-based hand product, tell them to go do it. And just say, I didn't see you do it, would you go do it? It's okay. We're used to it because we always want to make sure that we have clean hands. The other thing in terms of your incisional area is that you will not be able to soak in any kind of water for a while. So no getting down into a bathtub, hot tub, whirlpool, swimming pool, ocean water, sound water. Try to not go fishing, things like that for a while, because we want to make sure that this is completely healed before you have any exposure to that, okay? You'd be surprised at how many organisms can be in water, and especially our recreational water, that could enter your body through an open area. Monitor for signs of infection. Critical. Once you leave here, you are, and your caregivers are our eyes, okay? So look for signs of infection. Redness, hot to touch. If there's any streaking that might go up or down your leg, little red lines that might go up or down from the incisional area. If after the staples are open, it breaks open and it starts draining, if all of a sudden your incision. Those are all reasons to call the doctor's office, not to wait for your follow-up visit. If you're having more pain than you've been experiencing, all of a sudden it's getting worse instead of better. If you start running a fever, those are also reasons to do that. And questions? Any?
You said no soaking, that will not include the icing?
No, that's going to be totally different, which Micah is going to go over, because that is going to be contained. You're not really soaking in ice. Anything else? Some of you I've seen for a preoperative visit. Some of you I look forward to seeing one-on-one, and we can talk a little bit more in depth.
How long would it be before you can wear heels?
I'm going to defer that one to the doctor's office,
Right there, they're gonna work out just fine.
Oh, okay.
because you really are going to have to be safe for a while to make
Okay.
sure. And so my recommendation, and I'm sure,
3 months.
yeah,
Oh, okay. I just
Yeah.
want to make sure. Before I put them on.
yeah. Okay. Next we have our registration business office.
Good morning.
Good morning.
My name is Patricia Minifield, and I'm Director of Patient Business Services. And we will be starting you on that journey to wonderful parts that you're going to get, those new parts. This is Kristen Richardson. She's going to be talking to you first, probably from our department.
Yes, if I haven't already called you, I will be calling you to pre-register for your surgery as well as your pre-op appointment. And we just verify your demographics, make sure everything's correct, verify insurance, and just make sure that no pre-op is needed with your particular insurance. And we can go over any questions you may have. And then you can always call me at that 252-449-4508. That's my direct line with any questions about your registration, insurance, anything like that.
So once you are pre-registered, once Kristen calls you and gets your information, then you're going to come to the hospital. So those of you who may come prior to 7:30 in the morning, we do open at 7:30 in outpatient department. You will go to the emergency room and check in. They will have all of your paperwork there if you're coming prior to 7:30. And of course that depends on the appointments that surgery and the doctor have given you. So you will go there to ED registration, and they will make sure that you get to where you need to be for surgery to come and get you. If you are coming in the main lobby and it's after 7:30, you'll check in at the desk and someone will direct you to our department where we will do your check-in. So basically, Kristen's already pre-registered you, but we're going to be asking you some other questions about falls and other kind of risks. We'll also be talking to you about MyChart, but Kristen will also ask you if you would like to access MyChart. Does anybody know what MyChart is? No? Yes? Okay. We'd love for everyone who has surgery to be on MyChart. You don't have to have a web address to be on MyChart. All you have to do is be able to have access to go in and look. And what happens is any information from your doctor's office, if you are signed up for MyChart, you'll be able to see it directly and as soon as they put it in. If you have any questions of your physician, if you have prescription refills, anything like that, all you have to do is go online, put that information in, and they will probably do a turnaround of maybe 24 to 48 hours and get your question answered. If you want to make an appointment, you can also do that on MyChart. So we'd love to sign you up. When you pre-register with Kristen, she'll ask you your information, and she can actually send you the link so you can go in and sign up for MyChart. If you have any questions about that, you can certainly call her at this number and she'll help you get signed up. Okay? So it is a wonderful thing. You'd be able to look at your lab results. Any of the doctors that are Vidant doctors will be on MyChart. Okay? So once you come into the information desk and you've signed in, someone will help you and they will get you to sign your consent for your treatment and billing. And at that time, if there's anything that we need to do to make sure that your financial state is a smooth transition so that your bill is paid quickly, that's our main goal, is to make sure your insurance is correct, to make sure everything is right so you have no responsibilities after your bill comes. We also have a program here where if you have a loved one or a family member with you, we give you a number so that when you go to the waiting area for surgery, you'll be able to tell exactly what stage the patient is in. So whether the patient is waiting for surgery, whether they're in surgery, if they're out in recovery, you'll know all that information just by looking this number up on our board that we have in the waiting room.
Again, my name is Micah Puffer. I'm the Assistant Nurse Manager for the Medical Surgical Unit on the second floor. I'll talk to you a little bit about our operating room. This is actually a photo of our newest operating room. We have three. You can see it's large, state-of-the-art. They did a really great job building that last year. When you are done with registration, one of the nurses will come and get you from the waiting area. They'll take you back to get you all checked in back there. They'll start your IV, maybe give you some medicine, get you changed into a warming gown and things like that. Your family can usually stay with you there for a little while until it's time for you to go, and then they'll be shown where the waiting area is, where again you can track that progress with the board that's up in the waiting room. After the procedure, you can expect the surgeon to come out and fill your family in on how you did and let you know that you'll be heading up to our unit shortly. And then you have a packet in your information in your packet, more specific about surgery. All right. Yes, ma'am.
How long does this operation take for the knee replacement?
Typically, it lasts anywhere from 2.5 hours for most procedures. It depends on each individual case, but you can average, probably, I would say average is about 2.5 for anything, whether it's a hip or a knee.
Any other questions about surgery itself? All right. We'll move on. So your surgery is over and you are ready to come up to Med-Surg. You'll be brought up by the recovering nurse, and a report will be given at the bedside to your nurse on Med-Surg. We wanted to really help you visualize what that will be. This was working for me. We'll get there. Technical difficulties. But anyway, we put together a video. We wanted this to be a familiar process to you. That's the whole point of this class, is so that you can know exactly what to expect. So we created a video, which will come. You can hear it. We created a video to show you the process. Hi. Looks like you just had your joint replacement with us. My name's Micah. I'm one of the nurses here at the Outer Banks Hospital. Looks like Jeannie's ready to take you upstairs from the post-anesthesia care unit, or PACU. I'm going to accompany you up to your room where you'll continue to recover for the next few days. Let's go. Here we are, room 226. Looks like your nurse Susan's ready to receive report.
Hi, I'm Susan. Welcome to the Outer Banks Hospital Med-Surg Unit. I'll be taking care of you today.
Here at the Outer Banks Hospital, we practice patient family-centered care. One of the ways we do this is by giving nurse-to-nurse handoff at the bedside. That way we make sure we all have the same information at the same time. We also update the communication board in your room throughout your stay to make sure that you know who's providing your care, what's planned for your day, and other details. All of our rooms are private rooms. As you can see, they're quite spacious, which is important later when the physical therapist comes to work with you. You may also notice that your bed has an apparatus hanging over your head. This is called a trapeze, and it will help you move around in bed. In the room, you'll also find a space that your friends or family may use if you'd like them to stay overnight. In an effort to provide patient family-centered care, there are no set visiting hours. Please let us know if there's anything that we can do to make your stay with us more pleasant. Well, you've had quite a day. I'm going to go ahead and let you rest, and I'll check back with you a little later. Your nurse tells me you're starting to have some pain. Pain management is an important part of your recovery after joint replacement surgery. While you're here, we're going to ask you to rate your pain 0 to 10. By providing us a number, you help us to choose the most appropriate method to keep you as comfortable as possible. We will probably use a combination of IV and oral pain medicines to help control your pain. The goal is to keep your pain manageable, which will help you to move and participate in your therapy regimen. While the expectation is not for you to be totally pain-free, it is to reach a pain level that's tolerable and promotes your recovery. Our physical therapy team will meet with you shortly after surgery. Did you know that many patients are actually able to get up and walk the same day as surgery? Current evidence actually tells us that the sooner a person gets up after surgery, the lower their risk of complications and the better their recovery goes. Also, if you have a urinary catheter, your nurse will work to remove it for you at the earliest appropriate time. Rest in the hospital can be tricky. We do our best to provide a calm and restful environment. However, there may be times when your care providers need to wake you for important tests or to administer a medication. Our unit also has some equipment which makes noise to alert the staff to actual or potential issues. This is all a part of keeping you safe. If our equipment noise bothers you, please let us know. We may be able to close your door or provide another method of decreasing the noise in your room. We recognize the importance of rest in your recovery. At some point shortly after surgery, a discharge planner will come to your room to speak with you about what needs you may have after surgery. She will be able to help you make arrangements for rehab, equipment, and medications. Most patients leave the hospital 2 or 3 days after their procedure. Your discharge planner will make sure that you have everything in place for a smooth transition after the hospital. Well, you've done really well after your joint replacement, and the doctor says you're ready to go home. I'm so glad that you chose to trust us with your care at the Outer Banks Hospital. On behalf of your healthcare team, we wish you a speedy recovery. Well, that may have answered some questions for you. Do you have any other questions that you would like to ask about recovering on Med-Surg? All right, must have been a good video. One thing I wanted to show you, when you come up from surgery, you're going to have one of these on. This is the ice machine, the cooling machine. You were mentioning about ice on your knee. Any knee patient will have this. This doesn't normally come with a hip. But it's neat. It plugs into the wall. You fill the inside with ice water. And you do it the right way. Fill the inside with ice water. It's got a little pump, and it circulates that ice water through the pad. Stays cold for quite a while, and it helps keep the swelling down after surgery. And then it's yours to take home afterwards, so it'll go with you.
Is that like 30 minutes on, 30 minutes off? No?
That's usually what's recommended.
Okay.
So what does it have, like a switch? I mean, it has a switch on and off?
It has it's just a plug.
Oh,
Plug
I
it
see.
in it.
And a handheld thing? No, I'm talking about turning it on and off.
Just plugging it in. It doesn't have a switch. Just plug it in, it turns on. You unplug it, it turns off.
So when does that start?
You'll come up from surgery with it on your knee, and we'll have it on
Versus
throughout your.
after it?
Mhm.
Oh,
Yep.
that's what
Yep, and we'll fill it up with ice and keep it cold for you.
So we don't have to get up and do it.
No. We're going to take good care of you.
What about the motion thing that we used years ago after surgery? Are they still using?
Yeah, I'm going to let Amy talk a little more about that, but the quick answer to that is generally no.
No.
Evidence, they looked at evidence with that and they said that people really don't do better with those generally unless you have limited mobility. Folks who maybe don't have as much flexion in that knee, after surgery they may do it just to increase that mobility, but Amy will talk about that a little more.
Do they put those, what are the things that inflate on your legs, no matter what kind of surgery you have?
Yep, they're called SCDs, or sequential compression device, and the point of those is to squeeze on your leg when you're laid up to help prevent blood clots, because our bodies use the walking motion of our legs and the muscles in our legs to squeeze the veins and to force the blood back up. When we're not walking, blood can pool a little bit, and that will put you at risk for blood clots. So you'll have, all of you will have those on your legs, at least until you're up and fully mobile, probably up until the day of discharge. Unaffected leg. I'll hand it over to our physical therapy team, or therapy team. Both.
So I'm Amy Robinson. I'm a physical therapist, and this is Angie Getz. She's an occupational therapist. So we are going to go over rehab and in-hospital expectations for therapy, and then we'll even discuss moving on to home and the expectations once you leave the hospital and things that you'll need to work on. So first, I want to point out in everybody's booklet that there are exercises, whether you have a hip or a knee replacement, there is a section for both. Now it says exercises to do before knee surgery, but I just want to point out to you, but these are the exercises that we teach you in the hospital, and then we will expect for you to do when you go home from the hospital. So it's not just before, it's actually before and after. Okay, so everybody can just make a note of that. Now you are definitely more than welcome to go ahead and start looking at these, and you can by all means do them before surgery. It definitely makes things easier after surgery if you're already acquainted with the exercises and what to expect. Okay. And then also I want to point out in here quickly is if you are having a hip replacement by Dr. McKenna or Dr. Chase, I'm going to go over them anyway. You have something called hip precautions, that there are some motions that you need to avoid after surgery until your doctor releases you from those precautions. So those are on page 22 of the booklet. So those 3 motions for people that would have a hip replacement by Dr. McKenna or Dr. Chase are to avoid a 90-degree angle, so you don't want to bend your hip past 90 degrees, which means you're not allowed to bend over and touch your toes. You don't want to cross your legs, so that's taking the affected leg across the midline of your body, and then you don't want to turn pigeon-toed, so you don't want to rotate that hip in an inward towards the middle position, okay? And those are just to maintain the stability of your hip until everything has time to heal. For those of you that have the anterior approach with Dr. Mann, these precautions do not apply to you, okay? So just so you know that. A lot of people think if they're having a hip replacement, they all have to follow the precautions, but not the anterior approach done by Dr. Mann. All
So
right.
are there any precautions that do need to be taken with Dr. Mann?
Pretty much your pain will restrict anything.
For a certain position.
Right. I mean, no, there are no specific restrictions other than what your pain allows you to do.
Right.
Okay? So additionally in the hospital, just to give you some expectations, it was mentioned in the video that you may get up and walk the day of surgery. That is not typical. While if somebody's really anxious to get up that first day, we definitely either can you just sit on the side of the bed, possibly stand, but really majority of you will be seen the morning after surgery. So you do get to rest the day of surgery. We will come up the next morning and one of the physical therapists will help you get up, sit up on the side of the bed, stand up, depending on how you're feeling, is really how far you walk. I mean, our goal the first day would be to walk to the doorway of your room, but again, if all you're up for is a few steps to the chair, then that it's based on, you know, your reaction to surgery and anesthesia and pain meds. Everybody reacts differently, so we really just base what you do on how you're feeling that morning. With no concern that you know, within the first 2 days, you will be walking distances long enough, usually 75 to 100 feet, which is a distance that most people would need to do in their homes. So that's typically our goals while you're here in the hospital. Everything that we're going to teach you, there's information in this booklet on how to get in and out of the bed, how to get up and down from a chair, how to use a walker, all things that we're going to be teaching you while you're here in the hospital. So they're in here for your review, but don't feel the need to know everything that's in this booklet. That's all the things that we'll help you with while you're here in the hospital. I'm going to talk briefly on home health versus skilled nursing facility, but our discharge planner will cover that more. So when you leave the hospital, you will have in place set up additional therapy. So most of our patients leave with home health physical therapy set up at their house. In some cases, if your mobility isn't quite to where it needs to be to go home, or perhaps you don't have a caregiver at home, then there is the option of skilled nursing facility where you would go and stay as an inpatient and receive your therapy services there. Okay, so those are those options. Outpatient therapy, again, it's different for every person, but your home health therapist and the doctor will help determine when and if you need outpatient therapy. Not everybody needs to go on to outpatient therapy after home health, depending on your mobility, depending on how well you're moving around. Again, that'll be determined you know, with your home health therapist and the doctor. But if you do need outpatient, you know, we have it at the hospital. They have it at the beach in Kitty Hawk. They have in Mania. There's a lot of options on where you might go for that. Let's see, Angie, you're going to cover equipment.
My name's Angie Gish, like Amy said. I'm one of the occupational therapists here. The role for occupational therapy in your acute inpatient stay is we want you, when you leave here, to be fairly independent with managing basic daily stuff. Getting out of bed, getting to the sink, getting dressed, getting shoes, socks, pants on, things like that. Again, you're all getting different kinds of surgeries, hips and knees, Like Amy said, only a few of you will have these joint precautions. Those are the hips from Dr. McKenna or Dr. Chase. And we'll review them while you're here multiple times. That's the no bending past 90, no crossing legs, no internally rotating the foot. Whoever's having one of those procedures then will definitely receive the adaptive equipment. We use these long-handled devices so that you can still be independent with your basic dressing tasks, but still adhering to your hip precautions and protecting your hip. Some of you who also are having hips by Dr. Mann and any kind of knee, we will come up and assess if you need equipment. Some patients, they don't have the best mobility in the knee right away, or they're having pain when they're trying to bend over. If we feel like you could benefit from the equipment, we'll assess you and we'll issue equipment and teach you how to use it. Most of the patients here just get one visit of OT. They do fairly well once we instruct on the precautions, instruct on the equipment, and take the equipment home with you and use it as needed until, especially if you have hip precautions, you're going to use it until your physician tells you that you no longer have those hip precautions. If you're having a procedure that does not have precautions, you can use the equipment until you feel like you can manage without overstressing that new joint, hip, or knee and not increasing your pain. Any question?
So that's a case-by-case basis?
Correct, yes, correct. Definitely everyone that has having a hip with the joint precautions will be seen by me. Everyone else, I may come up and see you and do an assessment and see if you can benefit from it. And if so, then we'll go through the education, instruction, make sure you're using it correctly. But again, case by case.
Do you want to cover?
Thinking about going home, like Amy said, the majority of you will all go home with home health. Most patients leave the hospital and go home. There are a few that will go to skilled nursing and things like that, but the majority will be going home. So prior to coming to the hospital, think about when you are coming home after having that hip and knee done, you know, having some meals prepared, moving things around, getting furniture out of the way. We always tell patients pick up those throw rugs, you know, into the bathroom and things like that. Anything that the walker can catch. We want a nice, safe, clear path from your bedroom to your bathroom to your kitchen, wherever you're gonna sit. Get things out of the way, things that avoid tripping or fall risks, things like that.
So-
And the therapist, when she comes home, will talk to you about that more.
Walkers are generally used for knee replacement.
Correct.
Mhm.
Pretty much everybody will be on a walker.
For a period of time. Not for very long, typically. I mean, maybe a few weeks, maybe a month for some people, maybe a few days for some people.
Whatever you're right, we'll start with a walker.
So I will lead into pain management, already briefly covered in the video, but we like to cover it from a therapy standpoint. Is the surgery that you're having will be painful. You have pain now. The pain after surgery, your arthritic pain will be gone, but you will have surgical pain. So we would just want to prepare you for that when we get you up and start moving you. Even if when you're lying in bed, coming out of surgery, you feel fine and you have no pain at rest, and the nurse comes and offers you pain meds and you say, no, I feel good. I'm just asking that at least the first day, and really while you're in the hospital, that you take your pain medicine as prescribed by the doctor so that you are able to participate in therapy as needed, okay? We try to come, in the mornings at the 9 o'clock time, but depending on our outpatient schedule downstairs, sometimes it might be a little earlier, it might be a little later, so best to just, if you stay on your schedule with your pain meds, then you should always be covered. And it is important so that you can do what you need to do to get mobile and get out of the hospital, okay? Because that's our goal, is to get you out safely, in a short period of time so you can get home and start that part of your recovery. And just knowing that it's going to be uncomfortable when you get up and you start moving. And so the realistic expectation while you're here in the hospital is, that you'll be getting yourself in and out of bed pretty much on your own. Maybe your caregiver might have to help move your leg to the edge of the bed, but essentially you can get yourself in and out of bed. You can walk short distances where you'll be able to, go to the bathroom, walk to the kitchen, walk to the living room. If you have stairs, which, probably more than 90% of the people on the Outer Banks have stairs of some sort at home, we will be practicing stairs with you before you leave the hospital. So if you're concerned about that and being able to do stairs, really if you can walk, you can do the steps. You just do one at a time with, holding a handrail and with your caregiver there with you. If people really are unable to do the stairs before they leave the hospital, in Dare and Currituck County, you can get non-emergent assistance. The EMS or the fire department will come out and help you into the house. So if those are concerns for anybody, then we do address that. So any other questions regarding what to expect with your therapy in the hospital?
How much flexibility are they going to go with the range in the knee in the hospital?
Our goal is 90 degrees. So if you have 90 before surgery, the doctor flexes you in surgery and makes sure you have full range of motion.
What's considered full range of motion?
Well, full range normal is 120 to 125. A lot of times leading into surgery, though, you have a loss already. But if you have 90 now,
90, yeah.
okay, then our goal is 90. That's why we start moving you, the first day, bending. Coming back to the CPM question, a CPM stands for continuous passive motion. So that is a machine that will bend and straighten your knee. This is for knee patients only. Because of research and because of discussions we've had with the physicians here, they pretty much let us look at you and look at your motion and decide if you need a CPM or not. Typically, we're not using them as much, but if somebody really has a limitation in their motion because of restrictions before surgery or they're swelling and they're really having trouble bending, then we will use it if we need to. But some people like having the machine move them, but better to be actively moving it. That's what we encourage, is that you actively start bending your knee. And you are,
keep it moving.
yes, and you are allowed to start moving your leg in bed before we come for physical therapy. So, you know, definitely, if you feel like you want to move it, definitely start bending it.
Now, when you say walking, is that straight legged or is that bending your knees?
We try to get you bending your
maybe
knee
more
and walking
bending
as
at the same
normally as possible. No, unless there's a complication or the doctors let us know, everybody with both hip and knee replacement or what we call weight bearing is tolerated, which means you're allowed to put full weight bearing on your leg, only what your pain, you know, keeps you from doing, which we encourage full weight bearing with normal step pattern.
So we'll have the therapist coming to our house?
Yes, not a therapist that works here at the hospital. Once you discharge, a home health agency will send a therapist.
Yeah, because I live right there by the YMCA in Currituck. Most of the care is inside of there.
That's an outpatient facility. Now, there are some people that'll go straight to outpatient from the hospital, but typically you'll have at least a couple weeks of home health first, mainly just for getting out of the house and, you know, that type of thing. They'll come, and then the home health therapist, when they feel like you're moving around better, then you'll transition to that.
Okay.
Any more therapy-related questions?
Do you want to mention the exercises in the handbook that they have? I think most of them have it open.
I did, yep. But if you want to bring this with you to the hospital, those exercises that we pointed out, because those are the ones we'll be reviewing with you, and then a lot of times you want to refer to it while you're here in the hospital so that you can do them in between your therapy sessions. So if you think to, bring it with you. If you don't, we have extras and we can share. Okay?
Are these the same ones after?
Yes. There's a section for hip and a section for knee in the booklet, so they're a little different. All right, great. Thank you.
Hi, I'm Lauren. I am the case manager, discharge planner. And so my job at the hospital is to help arrange everything you're going to need in order to get out of the hospital and to continue to recover at home. So primarily what you need in order to leave the hospital is a rolling walker. Everybody needs one of these things. If you have one already at home, please bring it, and Amy or the other physical therapist can make sure that it's sized appropriately to you. And any other equipment that you want them to look at, please bring. The other thing that is optional is this, which Medicare and most insurances consider a 3-in-1. So what it means is that it does 3 jobs in one. You can use it as a bedside commode next to your bed. You can take the bucket out and put it over your existing toilet, and the legs are adjustable, so it raises the height of your toilet, and it gives you arms to push up off of. And it also serves as a shower chair, so you can bring this into the shower. Some people, this isn't feasible to bring into the shower, and there's something called a shower bench or a transfer bench. Most insurances don't cover that, and that's an out-of-pocket expense, but that's something I can certainly help you get. Where to get it? I can bring it to you from the hospital. We have a company here that's contracted with us called Advanced Home Care. It's upstairs, and I'll bring it to your room. You can also get it from a handful of other companies. They're in your packet. And you can get that in advance of the surgery, or certainly you can get it after surgery and wait and decide what you truly need. Again, the CPM machine is something that people used to sometimes be discharged home on. There is not a company on the Outer Banks at all that will provide that at discharge, unless you wanted to go to a skilled nursing facility, and even then, I don't know that they truly have them that often any longer. Could you go back to the other slide? The other part that you and I and the therapist will decide is where you're going to go. Most people will go home and have home health. the home health agency is determined generally by your preference and where you live. So for you who lives in Currituck County, you're not going to have Dare County Home Health. They won't cross the bridge. So it just depends on where you live, and we'll identify who works with your insurance and who makes the most sense for you. Typically, you go home after 2 days if you are going home with home health. Skilled nursing facilities require insurance approval if you have a commercial plan like Blue Cross Blue Shield or United. Medicare requires that you're in the hospital 3 inpatient nights. So if you have surgery on a Monday, you'd have Monday night, Tuesday night, Wednesday night, and you'd be eligible to go somewhere on Thursday. So the sooner you can decide, especially people who have commercial insurance, the better, just because it takes a little bit of time to get that authorization going. And I would hate for you to sit here in the hospital waiting on your insurance. And again, outpatient therapies, you have to be doing really, really well in order to even want to get out of the house that much to do outpatient therapy right after being in the hospital. But if that's something that you want to do and that you're capable of doing, I will help you set that up. Certainly you have to have a reliable driver because in the beginning you won't be driving yourself. Advanced directives is something that's important for everyone to have. You have a copy in your packet. We have them here at the hospital. They are the healthcare power of attorney and living will. The healthcare power of attorney is a person who makes medical decisions for you if you ever become unable. I can help you complete them. It just requires a notary and 2 witnesses. You can do it at the bank, wherever makes sense. It's just a good idea to have. It's certainly not required. Does anyone have any questions? All right.
So I'd like to take an opportunity to introduce Ms. Foster. She has come today to tell you her story, a patient of Dr. Mann, and she had all 4 joints done. 4 joints.
She was 999.
Patient 999. Thank you.
It was hard. It was way worth it. I literally was on a walker before I had surgeries for almost a year. You can ask me anything. The nurses are fabulous at the hospital. The home helpers, I live in Currituck, are wonderful. They're really, really good. And I went to outpatient at the Y also, but not very long. Also, one of the real benefits for me was I take water aerobics, and I still do. And they have several classes, and it's really good after you're approved, you know, for it. I mean, the physical therapists here tell you everything you need to know. It was, the worst part to me was the first time you had to stand up and walk. Make sure you take your medicine. Make sure you do all your exercises, because it really, I mean, I just saw Dr. Mann this morning for the last time. He said I was a perfect patient. I did everything I was supposed to, and I recovered quickly. And hips are really much easier than knees. I mean, knees are, you know, it's rough, but all of the, I think the physical therapist came to my house 3 weeks for knees for each one, and only less than 2 for my hips. And the hips, I never had to do physical therapy, but that was me, because I was continuing to do the water aerobics. And now I'm actually going upstairs, it's only been 3 months, and working out on the machines upstairs at the Y. Love it. So, so happy that it's over.
Did you have both knees done?
Yes, both knees and both hips. I had
Really?
my hips done. It really is. It's a miracle. I mean, really. I had one hip done Thanksgiving, right before Thanksgiving, one done at Christmas. And like I said, I just saw Dr. Mann for the last time. And doing exceptionally well, walking really good.
No limps or nothing like that?
My knee is a little bit stiff, but he said that was normal. Every other joint is like nothing ever happened. Okay. I mean, that's how really well I did. It's awesome. I mean, really, it really is. And I told him, I said, it's a miracle. I hugged him, and you know. Yeah. He's so wonderful and so kind if you have him, but the other doctors are great too. So, any other questions? I will tell you this. I had a little bit depression after each surgery, which is like post-traumatic stress and the medicine. So maybe you want to be aware of that, and you know, make sure you know you have loving family around, and you know, which I did, and was wonderful. I had a lot of family coming in, and
You didn't have both knees done at the same time?
no, and I did not have both knees done at the same time, which is rough. So, but anyway, any other question?
How did your family handle this?
My husband was told by the nurse of the first knee replacement to calm down. He was hysterical. And he said, to be honest today, and he said, you know, you need help for sure, especially with the knees. With the hips, I mean, he went back to work within 3 or 4 days after I was home. With the knees, it's definitely harder, and I could not live without the walker, you know, for quite a while. And then I used a cane. With the hips, I only used the walker for a few days at home, and then I've never had to use anything else since then, so really good. So. You can do it. It's well worth it. So.